Hi, welcome back to Christine's Health Affairs. I'm in my sewing room because that's where the camera is set up and I couldn't be bothered moving anywhere else. So I'm going to give you an update on how I've been going with radiation therapy, MRI. That ended up happening finally, although that wasn't without problems itself. So we went there, I think that was Tuesday last week. We're all ready to go to have the MRI. I went into the pre-op MRI room ready to be anaesthetised. The anaesthetist didn't come to see me. They were really late getting things done because there were a couple of kids in the queue before me. They were emergency cases. So, of course, the MRI nurse came up to me and said, we won't be able to go ahead. So I wasn't very happy about that. She came and gave me her reasons why they weren't going ahead, and I really wasn't happy. I was just so frustrated because we'd both driven, Chris and I had driven an hour each way both times to have this procedure done. And I just said to her, I said, look, I don't need your excuses. I said, it's either going ahead or it's not. But look, she actually went and spoke to her colleagues and they organised to have my MRI done later on in the afternoon. So I had to wait around a few more hours, and finally in the afternoon I had my MRI done. I don't remember a thing. I was knocked out. They assured me that I was going to be asleep before they put a cage on my head and I wouldn't wake up during the procedure or anything like that. They did tell me that it occasionally happens, which I didn't want to know. But anyway, I had my MRI. It's all done. I haven't got the results yet. But look, I think everything's going to be fine with that. I've been having my radiation therapy. I've done 8 sessions so far. And it's going pretty well. I mean, it's early days. I'm only having 15 sessions as well, by the way. It's early days. And I'm, apart from feeling tired the last few days, I don't have any side effects from the radiation therapy. I haven't got the burns showing up yet. Putting lots of QV cream on the area that's getting radiated. And I have a video to show you as well. It's a video of my procedure when I go and have radiation therapy done every single day. And to overcome my fears, I kind of started playing a little game with the machine. And because I'm a bit of a control freak, well, I'm a lot of a control freak. So I wanted to try and control the way the machine works. As I mentioned in a previous video, it's I'm using a breathing or a deep breathing technique for the radiation. So when you take a deep breath and hold it, the machine starts radiating. And when you exhale, it stops. So it's completely controlled by yourself, which suits me fine. So I'm going to show you the video of my procedure this morning. When you go there, every morning there are these wings that kind of come around and envelope you, and they are a mini scanner. So once a week you have a kind of like a mini CT scan, and then every other day you have a mini X-ray. And this is just to locate or to make sure that you're in the correct position. So prior to me starting this procedure here, there are 2 technicians that come in. They position you with lasers and they put a box on your belly so that it can monitor your breathing, and they line everything up so that you're in a perfect position. So the technicians have already left the room. So then these little wings on the side, or these great big cameras on the side, they take a couple of photos of you just to make sure you're positioned. So today they're doing little X-rays. And with that, you only take some short breaths. So once they've finished taking a few images, these things on the side, they actually move out of the way. It's actually interesting seeing how these move away from the perspective that you're watching it from, because I only see it whilst I'm laying down with a big mushroom thing over my head. So once that's out of the way, then the big round thing that actually gives you the radiation, that starts around down by my right hand side, really low beside the bed, and then comes up. So I take a great big breath, hold my breath, and I take a count. Usually it's about 20 to 25 seconds, or counts in my head. and I manipulate it so that it comes up and finishes just to the right of my head. And that way I don't have anything covering the top of my head, because you guys know I'm claustrophobic, and I'm a big sissy, and I don't like anything in my face. So I manipulate the machine, or at least in my mind I do. I manipulate the machine so that it comes up and stops in the right hand position. I catch my breath, and then to hold my breath again, the machine moves over to my left, and that takes about 20 to 25 seconds again. And it goes to a certain position on my left, and then I'll exhale. And I've managed to work it out so that I can actually hold my breath long enough so that it finishes its complete cycle. Once it finishes there, the head rotates and does the radiation from a different angle. So once that's all done, the machine clicks and makes all sorts of soft noises. It's not loud. And once that's ready, I'll actually take my breath again, and the machine will go back over my head, and I'll stop it so that it finishes just to the right of my face. And then I take a breath again, and it comes back down all the way to the bottom. Down there, the machine does another rotation, comes back up, and then goes back over again. So this whole procedure this morning took 8 minutes from the time the technicians left until I was allowed to get off the bed. So it was not too long at all. Now, what I've been doing is trying to challenge myself to get this procedure done quicker and quicker every single time. So I set my clock as soon as the people come and call me to go into the room. The first short radiation day, it took 14 minutes and 57 seconds. And I managed to get that down to 12 minutes and 37 seconds. So I'm really pleased with that. If I can manage to hold my breath the entire cycle, then it works really well. I can get out of there really quickly. So the technicians probably think I'm a little bit nuts because I'm playing this game with the machine. But look, whatever works for me. I was really stressed the first time I had this radiation therapy session. They did the big scan on that particular day, which took 19 minutes because I timed that as well. And I was in tears. And it's funny is that there's a lady called Laura who commented on my previous video, and she said that she's undergoing radiation therapy as well. And on her first session, she lay there and cried. I did exactly the same thing. She mentioned about the tears running down the face, and you end up with tears in your ears. Exactly the same thing happened to me, Laura. And how often do you get itchy just as you lie there? You've got to lie there with your arms behind your head or up over your head, and the minute you lie there and you're told to lay perfectly still and not move, there's something itchy. It's like you've got an itchy nose, itchy eye. Every single time I lie down, I've got to have an itch, but I can't move. So I've got to lie there for the next 10 minutes or so, not scratching this itch. It's so annoying. Does that happen to you guys as well? But you know what? This has actually been good for me, the breathing exercises and me playing this little game with the machine. It's been good for me to get over my fear. I'm able to go into the room now and keep my eyes open throughout the entire procedure. When I first started, I couldn't. But although I had to open my eyes because there's a little monitor that's sitting above your head, and that's where you can see your breathing. So you follow that line and you breathe in and then you breathe out. So for me, playing this little game with a machine has been a really good distraction technique, not to have to think about things being enclosed, and also the fear of what you're going through. So yeah, radiation's doing its job, I guess. I'm coping with everything well. I am feeling tired. I wake up in the morning. I wake up in the morning and all I want to do is go straight back to sleep. So I am having a couple of naps during the day now, and I expect things to get progressively worse over the next couple of weeks. But we'll see how we go. Hopefully it isn't too bad for me. I am using the cream, as I said, and hopefully I don't get too much sunburn. I'm not trying to make light of anything with the radiation therapy either. It's a process. I'm just, I try to be lighthearted about everything that I do. The serious side effects are probably going to happen in about 10 to 20 years if they do happen. But if all of this gives me an extra 10 to 20 years, I'll take it. Yeah, I'm just going to have to deal with everything as it comes. Anyway, I hope you've enjoyed this video, and I shall catch you next time. Bye for now. I forgot, cancer's tough, but we're tougher. See ya.